My female friend, you can't live a long, healthy, vibrant life without sex hormones. Estriol, estradiol, testosterone, progesterone, and DHEA. You just can't. You may live a long life, but it's gonna hurt. If you don't believe me, take a close look at people that you love that are elderly, like my mother. If your mother's like mine, she moves around slowly and in pain. She swapped her muscle for fat and has compromised bone mineral density. She's got a hip replacement already. She needs the other one replaced. Both knees are problems. She can't sleep well, doesn't remember where she puts her keys. What a mess. And her favorite quote to me is, "It's tough getting older." That's bull, Mom. And because I love you so much, I'm dedicating this video to you. But please, please eat your protein first. Now let's get back to you though. You agree. You see old people struggling to walk and do most other things that they do. I was recently in an airport in Phoenix about a month ago and was behind an older lady in a wheelchair who was being wheeled into the train. The attendant spun her around, and as soon as she was spun around, she looked at me and I walked on and she faced me. I looked down with empathy. She kind of reminded me of my mother and she smiled. She looked back at me with what I best describe as a scowl and stated with disgust, "Ugh. Getting old is terrible." I just looked back at her like this. What was flashing through my mind is that you did this to yourself by taking the bad advice of your doctors. Take this med, now take this other med, take this one for the side effects of those two. I mean, it's just a mess, but don't take hormones because they're so dangerous. Thank you, Women's Health Initiative, for effing up an entire generation of women and some that I love dearly. You still don't believe me? Well, you don't really have to, because there's a small handful of amazing doctors in a group called the Menopause, which I love. Yeah, they're experts in menopause, and they're fighting back to benefit the best and most underserved gender when they need us the most post-menopause. Kelly Casperson, MD, You're Not Broken podcast and YouTube channel, and Kelly Casperson, MD on Instagram, which is my favorite. Additional MDs and DOs on Instagram are Alicia Robbins, Corinne Men, Heather Hirsch, Heidi Snyder, and the GOAT, Mary Claire, who you can find on Instagram and on all major news media, and is the author of a new book called The New Menopause. So I'd like to thank them for all of the work that they're doing and the impact that they're having on all of the women that you and I love so much. And hopefully more in the medical community will see the light and start doing a better job of treating women and not like small men. Because yes, you are in fact different from me in so many beautiful ways. I know. I mean, we all know this intuitively. When you think about menopause specifically, it just seems so obvious to me. You go through menopause quickly or sometimes over a decade, depending on who you are. But when it's all over, your ovaries will no longer produce sex hormones. Your little tiny adrenal glands sitting on top of your kidneys will have to step up. But they're sort of like an electrical generator when the power's out. It's kind of sketchy and not meant to be a replacement as your lights, figuratively speaking, kind of blink on and off. So in order to get back your youth, you have to replace them. Here's the shocking statistic though. Only 20% of postmenopausal women are on hormone replacement therapy. I mean, this is anecdotal, but what I hear from our female patients is that their OBGYN thinks it will give them breast cancer. That's the ugly shadow of the Women's Health Initiative in 2002. A major long-term study funded by the NIH found that estrogen replacement increased the risk of breast cancer, heart disease, stroke, and blood clots. I mean, it's super scary. So in 2002, women all over the world began suffering from low levels of sex hormones as they came off of their prescription estrogen. Since it's been found that not only is the estrogen causation of cancer inaccurate, but the heart disease correlation is the opposite. Yes, estrogen is cardioprotective. I mean, doesn't that kind of piss you off? Because what came after, as women began suffering from low sex hormones to add more misery to their misery, anxiety and depression, it just kicked in because it's a symptom of low sex hormones. And so estrogen prescriptions dropped, SSRIs like Prozac launched. This is terrible. I mean, a very closely related topic is the bidirectional relationship between mental illness and metabolic syndrome. I hope you're not suffering from that right now. If so, as you know, it's a snowball effect. Depression and anxiety lead to metabolic dysfunction. Metabolic dysfunction leads to depression and anxiety. SSRIs enter the picture. They may throw a lid on your depression, but they can also get in the way of rebuilding a healthy metabolism. So it's just an absolute mess. So let me ask you a question. Do you think perhaps all of the metabolic disorders we face in the US may be related to low sex hormones? I don't know about all that, but quite possibly for you, if you're entering menopause or are postmenopausal, in my opinion, we're living too long for our sex organs to produce sex hormones. But here's the thing, which may confuse you. Sex hormones aren't just for sex. They're for other things too. And maybe you're like, I'm good without sex. Fine. But I mean, let's talk about the quality of life other than sex as you get older. You don't want to be like my mother. These sex hormones of yours, not just estrogen, but sex hormones of which estrogen are a part, are steroids. You have lots of them circulating in your body, dozens of them, changing the genetic expression on a cellular level. It's very, very important work. Let me share some examples. Bone mineral density. Estrogen helps shuttle calcium into the structure of your bones. So without estrogen, you can become frail. Elasticity in your vascular system. Your blood vessels need to expand and contract. The opposite is sclerosis and all of the problems that are correlated with that. Estrogen plays a role in elasticity throughout your entire body and is cardioprotective because of that elasticity in your vascular system. Your skin, your hair, your nails, elasticity there too. I mean, come on. I mean, you're a little vain. That's why estrogen is used in some skincare products. Estrogen helps with skin thickness, pigmentation, maybe you need some of that, healing and repair, hydration, and collagen production. Cognition. Your brain needs estrogen to work properly. It modulates the production of serotonin, helping you feel relaxed and at peace. Memory, mood, etc. And what about all of that compromised connective tissue like your tendons and ligaments, that tennis elbow giving you joint pain? Estrogen to the rescue, baby. You don't just need estrogen, you also need progesterone. And as you've started experiencing symptoms of menopause, how has your sleep been? Probably kind of rough. I mean, believe it or not, I take progesterone myself for sleep. Yeah, I mean, men have these hormones as well, and it is amazing. What about vaginal dryness, painful intercourse? Dang, I mean, that sounds terrible, but it's optional. Estriol and estradiol to the rescue. And did you know that you have more testosterone circulating in your body than estrogen, even though you're female? Yeah, that's a part of hormone replacement therapy as well. Let's talk more about testosterone. Has your body started to kind of fall apart a little bit, lost some muscle mass? While T has an indirect impact on bone density, it can also have a direct impact on insulin sensitivity and lean mass. So you'll be able to rebuild that booty, which is not just for me looking at you. It's for you to be strong as you age. You'll also find you have greater enjoyment of life in general. You want to do more. You have more joy in life, in everything that you do. You have greater capacity in general. You're sort of expanded. It feels like dopamine. So in conjunction with estrogen, testosterone will also help with cognition. Memories, both long and short term. You'll feel sharper, maybe even more charismatic, maybe even funny. So here's the real world problem with waiting. With every passing year after menopause, some permanent damage is done, which is aging. Some of it can be repaired, some of it can't. So go see your doctor ASAP. Famous Dr. Peter T, I love this guy, and others believe that you should be treated way before the onset of symptoms. And what I think he means by that is you go into perimenopause in a state of peak health, you're just going to be able to withstand it better, get through it more quickly and more easily, weather the impact. And that applies to everything health related. So now is better than tomorrow. Tomorrow is going to hurt more. You'll have problems that you won't be able to reverse. But what if I told you that all of that uncomfortable change that you're experiencing, it can be erased and replaced by some of your youth? Does that sound too good to be true? It isn't. And I'll explain that in a moment. If you're ready to take the next step in your health journey, go ahead and subscribe to my channel and join thousands of other women who've already begun to tackle this all too confusing and all too important topic. And together, I'm happy to help you build the knowledge you need and the confidence that you need to make the right decisions about your body. I have a friend who's a Stark student who is extraordinarily successful. She built a tech business with a couple of partners many years ago and eventually ended up taking it public several years ago, but she was struggling with all of the standard symptoms of low sex hormones. Her statement after going through the process, which took a while of slowly optimizing her sex hormones, was with this glassy look in her eyes, which I'd never seen before because she's such a stoic person. She put her hand on my shoulder, kind of lowered her chin, looked me right in the eyes and said, "Thank you for giving me my brain back." That's a very common reaction. And that's actually how I felt too when my sex hormones were optimized. There are a bunch of common misperceptions of sex hormones and hormone replacement therapy. And one is that story of my female friend. And sure, there are changes that happen from the neck down, but the most exciting impact of hormone replacement therapy, in my opinion, is from the neck up. It's the stuff between your ears. These sex hormones have a profound impact on how you think and how you see the world how you relate to others, your mental well-being. But the biggest and scariest misperception is that estrogen causes breast cancer. And that's just wrong. Again, don't listen to Todd, the random YouTuber without any credentials. Listen to those experts I listed and listen to the experts by whom I'm surrounded, my doctors. Here's another FAQ. Is it going to make me fat? It's common for both men and women to get actually heavier on the scale during the optimization process, which can take, for women, several months because it's fairly complex. But it's primarily water weight, which is shed later on, assuming that you're not counteracting all of the amazing benefits of this therapy by eating like an asshole or drinking like you're a college student. That is definitely going to make you fat. So will the absence of sex hormones. Yeah, I mean, you will lose muscle and gain fat in the absence of sex hormones. And most attribute those changes in body composition to simply getting older. You know how I feel about the whole age thing? Way, way overstated. Here's another. Do I have to be on it forever? Absolutely not. But you're going to want to be, because so much of your life is going to be enhanced through this therapy. You'll have a lot of your youth back, but this second chance will be better because you are now wiser and more patient. It's really quite remarkable when you put those things together. I think it's better than youth. Here's another. Are you going to have a heart attack or stroke? No. Remember, estrogen is cardioprotective. Women have seen a rise in microvascular disease over these years. And my theory is that it coincided with the end of HRT in 2002, because women with low estrogen levels suffer from a gradual decline of vascular elasticity. Am I too old? Currently, the experts are saying that HRT is only safe for women within 10 years of menopause, but that's changing. Our guru, when I asked him if he thought it was safe to put my mother on HRT, by the way, she's 78, he got quiet and serious, like he was sharing a secret with me or didn't want others to hear. He said, I can't think of a single reason why not. He's been practicing medicine for 50 years. Does it help with vaginal dryness and painful intercourse? Yeah. Think of yourself as a young woman and all of the things you experienced 30 years ago. How about urinary incontinence and prolapse? Yes, it helps with that too. How about bone mineral density? Yep. Estrogen, like I mentioned, shuttles calcium into the structure of your bones. Here's some additional misperceptions about HRT. It's not all about estrogen. It's about all of your sex hormones. You actually have more testosterone as a female circulating in your body than estrogen. You need them all to function well. So if you're perimenopausal, start optimizing your health now. I mean, there are so many natural methods for optimizing sex hormones. The one that comes to mind immediately for me is sleep. Oh, I love it. And when you're finally postmenopausal, the state of your health should be that you're merely missing sex hormones, not a host of other medical conditions, which then also need to be resolved. Regardless of your stage, find a great doctor, like right now, who is on the cutting edge of women's health. And remember, most doctors who went through med school between 2002 and 2017 were not taught much at all about women's health, certainly not menopause, and definitely not HRT because it caused cancer. And so if your doc was educated prior to 2002, they'll most likely believe estrogen causes cancer. So question them about how they feel about such therapies, which will be an indicator as to how much they've pursued continued education on women's health, which is different from men. You're not just small men. So you're likely gonna have to shop for a while until you find the right doctor. So shop, do it like your life depends on it, because in my opinion, your life actually depends on this. The quality of your life, what it's going to be like for you when you're 80 and 90. And in the meantime, while you're shopping, read and learn about your body. I mentioned the new Menopause book by Dr. Mary Claire. Check that out. It's a great one. And another angle on health, in general, check out Dr. Gabriel Lyne's book called Forever Strong. Amazing book for women. I have so many powerful, strong, influential women surrounding me, and I want you to be one of them. So come along with me, because you can't be all that without your health. Take responsibility for your health. Learn as much as you can and find the right health team. So if it's still a little fuzzy on how important HRT can be to your overall health, go ahead and click the link and I'll share with you some training videos on how to better understand how your body works and why your hormones are so critical to your overall health, and in their absence, how they can just drag your overall health down with it. We have a diagram called the Wheel of Health. It's something that we use as a training tool to teach you the skill of health. It'll give you a visual on how you're doing and help measure your progress and indicate whether or not you are close to a state of peak health in all the critical parts of health or not, and what are the areas that you actually should prioritize. It's a great tool. It's free. Go ahead and click the link.